Hello, my name is Margarita Blanco. I'm a nurse consultant with Lanterman Regional Center. Thank you for joining us today. Today's training is about COVID-19 vaccines. This is an introduction to the series, What You Need to Know About COVID-19 Vaccination. The series will be 3 separate modules, and the information will be in 3 separate videos. Before we get started, let me share this disclaimer that this presentation is for informational purposes only. This presentation is not to provide medical advice and should not be substituted for seeking medical advice from your healthcare provider. The information shared today is intended to help you make a well-informed decision and/or prepare for a more detailed conversation about COVID-19 vaccines with your healthcare provider. Please be aware that the information in this training is current as of March 25th, 2021, and is subject to change. So please continue to frequently check the CDC websites, your local and state public health department websites for changes and updates and guidance about COVID-19 illness and vaccines. So first, we'll review a little bit about what we already know about COVID-19. And we know that it's an infection that is caused by a virus known as SARS-CoV-2. We know that COVID-19 illness can range in symptoms and severity. There's some people that show no symptoms or are asymptomatic, and there's other people that get really sick and end up in the hospital, or they may even die from the illness. So we don't know how SARS-CoV-2, how the virus will affect each person. But we do know that some individuals, such as people who are over 65 and people with certain chronic medical conditions, may be more vulnerable to the illness and become severely ill. This is the reason why they've prioritized who will receive vaccines first and in what order groups will be vaccinated. Over the last year, we've learned that these preventive measures help us prevent the spread of COVID-19 in our homes, in the community, and in the workplace. These were the only tools we had available over the last year. And we know that we need to keep a physical distance. We need to wear a face mask in public and frequently wash our hands. We can even wear 2 face masks so that we can make sure that there's no holes or gaps on the sides and it fits snugly and covers our nose and our mouth. We also know that we can use alcohol-based hand sanitizer when soap and water are not available to wash our hands. But we're very excited that we have a new tool in our toolkit, and that's COVID-19 vaccines. This new tool can help us to prevent the spread of COVID-19. Now, I know that a lot of you out there have genuine fears and anxiety of vaccines. There is also a lot of misinformation out there that creates confusion for you. So today I hope to clarify for you some of the fact from the fiction and answer some of the questions and concerns you may have. I will start with this fact that each one of you is unique and your body's immune system is unique into how you will respond to the vaccine and if you'll have any side effects. Another fact is that COVID-19 vaccines will not give you COVID, and they will not make you test positive for COVID-19. So let me share the training objectives. Like I said, there will be 3 separate modules, and these will be training videos. And the first module will cover the 3 currently authorized COVID-19 vaccines. In the second module, we'll learn who is eligible to receive a COVID-19 and how to find appointments and book them. We'll also, in module 3, help you prepare for the day of your COVID-19 vaccine appointment so that you know what to do before and what to expect before, during, and after your appointment. I do recommend that you watch the training videos in a series because as you view the content, we will build on what was learned in the earlier modules. But if there's only a particular training video that you're interested because that's the information that you need, then you're more than welcome to view the particular video that interests you. I hope that these are helpful.